Today my topic is blood transfusion. Blood transfusion is indicated for some of the disorders or diseases, poisoning, acute infections, shock, etc. The transfusion disorders may be due to mismatched blood transfusion, due to matched blood transfusion. Due to mismatched blood transfusion, immediate effects are developed like hemolysis, shock, renal failure. Delayed cases leading to jaundice and renal shutdown and cardiac arrest. Due to matched blood transfusion includes two stages, immediate and delayed again. In immediate, pyrogenic reaction, shock, circulatory overload, hyperkalemia, hypokalemia. Delayed reactions are due to transmission of diseases, hemosiderosis, diseases like AIDS, syphilis, etc. Clinical applications of blood group. Why the blood groups are important for studying? In blood transfusion, in pregnancy, in disputed paternity, infertility, fertility and early fetal loss, diseases in relation with the blood group which having the incidence of a particular diseases, like example O blood group have twice incidence of duodenal ulcer than A or O blood group. In forensic sciences also, anthropological studies find the criminals in various ways. The blood groups are useful. Coming to blood bank, we know the place where blood is stored temporarily till it is used. The blood is mixed with some of the anticoagulants like acid citrate dextrose solution like trisodium citrate, citric acid and dextrose with the pH of 5.4 and 10 volumes of the blood to 1.5 volumes of the solution. In this way, it can be stored for 21 days only. The other form is citrate phosphate dextrose adenine CPDA solution. In this, trisodium citrate, citric acid dextrose and adenine are used with the pH of 5.6 to 5.6 to 5.8. Add 7 volumes of the blood to 1 volumes of the solution. This way, blood can be stored up to 35 days. Dextrose acts by the main action of the dextrose is liberating lactic acid, which by decreasing the pH helps in the survival of RBCs both in vivo and in vitro. It also providing a substrate for the metabolism which is required even at 4 degrees Celsius and thus helps in the survival of the cell. This is the functional activity of the dextrose. Some sort of changes will be there in stored blood called preservation injuries. Blood stored in the blood bank suffered some changes, where you can see decrease in the 2,3 DPG. Once the 2,3 DPG decreases, affinity of hemoglobin to oxygen increases, and increase in the potassium concentration in the plasma for changing of hyperkalemia, increase in the concentration of sodium in RBC, decrease viability of RBC, so they cannot work for longer time due to decreased ATP in them, decrease in the platelet count, increased fragility, are the some sort of injuries are there with the stored blood. So with this I have completed the topics blood bank, and the other one is known as blood transfusion. In case of hazards of the blood transfusion, already in part 1 blood groups I explained in detail RH system producing erythroblastosis fetalis, whereas ABO incompatibility causing immediate and delayed effects. Immediate effects are chills, rigor, tightening of the chest, and fever, sudden fever or there, but delayed effects continuously if you supply or donate the blood, in spite of producing some of the symptoms, severe jaundice, renal shutdown, cardiac failure are there. So ABO mismatched transfusion, that delayed reactions. So with this I conclude my topic of blood donation, and everyone can donate blood in every 6 months, and we can enroll our names as a regular donors so that we can give life to them who are suffering or there in the jaw of the death. Thank you. And in the next session, in the next class, I start the nerve muscle physiology with the introduction of the nerve muscle physiology. Thank you for patient listening of my lecture. If any doubts are there, you can ask me in your comment box. If you like my topic, please like it, share it, and subscribe my channel.